Good morning, everyone. It gives me enormous pleasure, together with Edyta, to kickstart today's meeting, today's conference. I know it's the second day of eHealth Forum. It gives me even more pleasure because I'm presenter for the very first time. I've been taking part in this conference before, but Edyta is also making a debut today, so I hope we'll pass it in flying colors. But before we start our presentation and give the floor to Edyta, let me give you a brief overview of Koma Nord. We are a dynamically growing integrator. We've been building our position for 25 years. That's how long we've been on the market. And our main advantage is relatively small, but highly efficient and tightly knit engineering teams. And we also have a sales team with deep insight into technologies and customers' needs. We have the right capabilities to roll out very complex and challenging projects. Working on projects, we team up with our technology partners and who are handpicked. For several years, we've been working very intensely in healthcare sector. Our biggest implementation in the medical sector to date. We've been participating in a project of new clinical hospital in Kraków, Kocyk, where we've basically built from the scratch the entire communication platform based on Aruba's Wi-Fi network. It's a technology leader in its class, and we are the only platinum partner of Aruba in Poland. And last week, we were named Aruba Reseller of the Year in Central and Eastern Europe. So it's Russia, Turkey, and Africa. So it's a reason to be proud. Just by the way, I wanted to mention it. This Wi-Fi platform, which is very well designed, we have launched a number of services. These are both location, voice over Wi-Fi services, and last week we have completed implementation of remote readouts of thermometers and thermofiber meters within all hospital premises. So this was a very innovative and challenging project. So we have used our experience to create the e-hospital concept, and the Wi-Fi platform is the backbone. Is the basis, the basic platform for implementation of a variety of services. I don't want to dwell into details, but you can read my article on Info eHealth if you want to learn more about it. You can download a complete catalog of solutions offered by Koma Nord. What else would I like to showcase to you? Well, we are collaborating with the National Association of Private Hospitals. Why? Because we see massive potential. I think it's been unappreciated in Poland, and the private sector is very active and innovative in Poland. So one of the after effects of our collaboration are good practices published by member hospitals of the Polish and European Private Hospital Association. Another initiative is a conference we are planning on staging on the 10th of December 2020, also under the auspices of eHealth Forum. SiDLY will be presenting its achievements and range, our joint achievements, to be frank, because we have achieved many things together. And right now I give the floor to Edyta. And I wish everyone an enjoyable day. Good morning and welcome, everyone. Well, Maciej has given a brief introduction. He has shed some light on our collaboration, but, just to tell you who we are. SiDLY is a company. I'm its founder. It was established in 2014. It was born out of the need to provide care to one of my close relatives. And I've come a long way from the vision, product design, implementation, commercialization, launch, building the team. So I went through a variety of stages. But at the end of the day, I've reached a stage where today I'm able to present a solution that supports not only caregivers, individual caregivers of senior people, but it also supports medical units providing care to inpatients and outpatients, and I'm going to tell you more in a minute. So our range today, we have 16 hospitals using our services in Poland and beyond. We have thousands of users taking measurements on our platform, and the number of measurements went up last year exponentially. Why? Also because of the pandemic and because this system has been widely used in hospitals, but I will tell you more about it in a minute. Okay, I do apologize. I have no access to my presentation. Okay, we have the time limit, so I'll be keeping an eye on time just to make sure that everyone's got a chance to speak up, also people who will follow your presentation. Okay, so SiDLY system is the world's first combination of medical, summon, and voice communication system. The concept was for the user to have the wristband. So the patient has to keep in mind that he or she has to wear the wristband. That's the only condition. So the wristband is taking automatic measurements, which are later sent to the platform, and healthcare professionals benefit from the platform where all data are presented and alerts are sent when parameters exceed standard values. So medical wristband in regular periods of time, 90 seconds approximately, is taking measurements including pulse, saturation, temperature, and is sending all data to the platform. In addition, the device comes with SOS button. The patient may press it anytime to connect, to get through the physician medical professional, because it supports two-way voice communication. So the patient can communicate directly with the caregiver or medical professional. Well, in addition, there is a sensor indicating whether the patient is wearing it or not, and the drop detector, which communicates that the wristband has fallen down. So telecare system is very often indicated by our customers as major support for healthcare individuals who are able to carry on with their daily tasks, and the system will alert automatically that further diagnostics is needed because life parameters of patient number 14 have gone up or have changed dramatically, and further verification is needed. Well, what is important marketing-wise, we are tapping into AI to save time because we don't have to monitor the patient as we go. You don't have to take manually regular measurements. On the platform, you can compare and verify different periods of time, check the efficacy of a given therapy over time. And this is very important for the patient, just like safety, constant monitoring, and the placebo effect or swift reaction capabilities facilitated by the SOS button. The patient knows that he or she may press the button anytime and anywhere to get through and initiate voice communication. It also comes with localization function. You can locate the patient within the building and outside the building using GPS. So as a result, you know what are the patient's whereabouts, you know whether or not the patient has left the building, and you can alert medical professionals if required. So hospitals are using the wristband very often. Our solutions are implemented in isolation wards where it saves time, where it translates into reduction of PPE equipment. You don't have to enter the isolation ward time and time again because measurements are automated. Readouts are available on the platform. So these are situations when we are able to minimize the number of interactions thanks to our solution. Lung and respiratory units are very interested in this device because it measures saturation. Intensive care. This is also very handy because when a given person ends up to the emergency ward, triage is the stage where the wristband is handed to the patient. And it's used instantly to monitor vital parameters, so patients can be prioritized. So this translates into much faster reaction of medical professionals. I want to stress that wristbands can be used beyond the hospital, and we are collaborating with clinics, outpatient clinics in Poland, in Holland, in Italy, to monitor people who are quarantined, for example, to check the pulse. It's two-way communication plus GPS functionality. So that means that the system can be used effectively to monitor people who are quarantined, and it can reduce hospitalization because you simply give the wristband to a given individual and monitor his parameters. It's very effective in remote monitoring of patients who are isolating at home. It boosts the efficiency of healthcare professionals in isolation wards. It boosts safety. The summon functionality supports two-way voice communication. It locates patients' whereabouts. It supports risk management. Ahead of a ward where this solution was implemented, calculated that in case of a 3-man strong ward, we are able to save monthly from 70 to 90 man hours. So benefits for the hospital, in addition to what I've mentioned, is higher safety of medical professionals and patients alike, because it takes the burden away from physicians and nurses. It ensures high safety standards for patients. It replaces it eliminates the need to use hospital equipment for measurements, mitigates the risk of accidents. So relying on my experience, relying on old user cases, what comes first for us is what customers say. So I have two testimonies. Thank you very much, but unfortunately, we have to interrupt. Time is running out. It was very exciting. I need 30 seconds to finish. Okay, I think we can give you 30 seconds, but, you know, you have to stick to 30 seconds. Okay, so he said that you can retrospectively verify readouts from different periods of time to evaluate the patient's condition. And another epidemiologist stressed that he sees wide prospects for applications of this device. I have very little time, so I can't tell you more about it. But this device is a medicinal product, class 1. It's a Polish product. We are very flexible. We are able to adapt the technology to partners' needs, which is why we have teamed up with Koma to integrate it with other systems. And I encourage everyone to visit our website, to contact Maciej and myself to discuss potential cooperation or development of the system. Thank you very much. I think I've made it in 30 seconds.